As a driven dentist, you see the world differently. Where some see scarcity, you see abundance. When others want to give up, you keep going. You're building an amazing life of significance. That means you can't rely on ordinary advice from ordinary advisors to get to your goals. You want advice that's going to help maximize your net worth so you can take even better care of the people you love, the causes you care about, and make your dent in the universe. But the fact is, this advice remains hidden because relatively few professionals are well versed in them, and the extremely affluent don't care to let you know about them. Join us as we pull back the curtain to reveal the often hidden advice and strategies used by today's most successful individuals and families. Welcome to Dental Wealth Nation. Here's your host, Tim McNeely.
Hey, welcome everyone to another edition of the Dental Wealth Nation show. And when you're in your practice, you have the privilege of treating patients. You have the privilege of helping improve their oral health. But today I'm so excited because you're going to know how to improve your patient's health and how to treat them beyond the teeth. You're going to have an understanding of why treating sleep is not only important in your practice, but how to do it and the big impact that you can have. But most importantly of all, you're going to feel excited to go back and really continue to make a difference and treat your patients and improve their lives. And when it comes to helping patients improve their lives through the treating of sleep apnea, I am so thrilled to have Dr. Dar Radfar. Dr. Dar is the CEO of Rad Health. Not only is he an amazing practitioner, but he's also helped me personally in my sleep journey and improve my health. And I am so grateful to have him on today. Dar, welcome to the show.
Thanks, Tim. I appreciate it. How long do we know each other? Like almost 15, 16 years, something like that?
Yeah, it's been 15, 16 years. And I was with you when you were first getting started doing sleep apnea lectures. And I was privileged to come in and help sponsor those and really share with the doctors. And I learned a lot from you. And so tell me a little bit about your journey, for our audience who doesn't know you. And how did you get involved in doing this?
Well, first of all, 12 to 15 years off your life. 5 times higher risk of cancer of any kind. These are some of the new statistics that if sleep apnea is left untreated, we run the risk of. And so in 2009, I personally fell asleep at the wheel, crashing my car into a tree, not knowing that I have a condition called sleep apnea. I was more tired throughout the day. At the time, occasionally I used to snore, especially if I had a couple of drinks. And this kind of wake-up call, pun intended, led me to get a home sleep study. Luckily, I didn't have to go to a lab even back then. And nowadays, patients and people who have the inquisitive mind to see if sleep apnea is present don't need to go to a lab. They can do it at home. A home sleep test was given to me, and I was diagnosed with mild sleep apnea. They gave me a CPAP. I couldn't wear it. It was not comfortable enough for me. The air pressure was uncomfortable, and I'm a stomach sleeper. So the cord kept wrapping around my head and my neck. And I was patient zero at my office. I made my first oral appliance for myself. It eliminated my snoring, and I just felt happier. I mean, emotionally, I was more kind of grumpy in the mornings, not ready to hit 30 patients a day and all the problems and negativity that you experience. There's some beautiful things in dentistry, but a lot of it is problem solving. And I feel the essence of what other dentists, my colleagues, have gone through. I've been doing this dentistry thing for 22 years, and I've been through the grind. I place your implants. I do Invisalign. I do traditional braces and crowns and do my own hygiene and all that stuff. It's crazy. But sleep has been the most rewarding, not only personally, but also for my patients for the services that I offer.
Yeah. Well, right. And I love that, right? Because I think you really do make a big impact when you're able to treat sleep. And so for you, why has that been so much more rewarding than doing crowns or implants, right? What about the sleep has been so rewarding for you?
The money. That's a joke. It's just been the fact that patients are coming back and their response has been, wow, like I am finally sleeping next to my bed partner, which has been, she or he has been sleeping in another room. I feel more energy to have with my loved ones. I'm more focused at work. I'm not taking naps in the afternoon. I'm not as anxious. And we'll dive into this later, but I just feel not as down and depressed. It has a lot to do with mental health as well. So, I mean, an implant, a crown, doesn't really have that much of an impact. Sure, as a dentist, we love to provide chewing and cosmetics, and those are some powerful things to be able to have someone smile and have confidence with their initial business card, as we call it, their smile. But nothing, their smile could be amazing. They could be chewing great, but if they're sleeping poorly, they're at a higher risk of death, let alone the social and emotional well-being that it takes a toll on a person. So even the slight sleep apnea occurrences that can happen for anyone in their 30s or 40s or kids, which we'll dive into as well, it can really affect their overall health down the line if it's treated too late. So I don't think there's anything else in dentistry that has that much of a powerful impact.
Yeah. Well, and kind of going back to your story, right? You mentioned you were patient zero in your office, and I think so often when people think about sleep, right, they are thinking about CPAP. They're thinking about, oh, I got to go see my general practitioner and work that out. But that's not always the case, is it?
Right. As a dentist, we look in people's mouths, and if you can find certain things, and I have a book that's going to be coming out called Rad Sleep. And in Rad Sleep, it shows how you can self-assess yourself, and then ultimately what kind of treatment options are there besides CPAP. Sure, some of it's losing weight. There's some surgical procedures now, but a lot of it is what are you experiencing? Do you see some sort of grinding patterns of your teeth that can show sleep apnea indications? That's what dentists look for. The dentists that I train, I tell them, look for lower anterior wear, the front teeth grinding, because the patient or the person's doing some anterior movement of their jaw, bringing their jaw forward, really creating their own mandibular advancement appliance. And so that is an indication. Large scalloped tongue, all these things, we look in the mouth already for gum disease, for oral cancer, for cavities. Why not look for sleep as well and just bring up the conversation? Hey, Tim, how well do you sleep at night? Does anyone tell you that you snore? Do you feel more tired throughout the day? And if you have no idea on how to do this thing, and you don't want to do it just because it's not of interest to you, at a minimum, if you see those kinds of, let's call it dental implications, and we can talk about medical implications as well, such as high blood pressure, acid reflux, depression, type 2 diabetes, history of cancer, heart attack, stroke. I mean, we have these patients already. If you look back at the medical histories of the people you saw today or a few days ago in your office, they're walking in through your office and leaving. And we look in the mouth 2, 3, 4 times a year for these patients when they come in for their checkups. Let them know, I see a problem. Please talk to a physician. Here's the board certified sleep physician in my neighborhood. Get their business cards and send it away. If it's something that you do not want to treat yourself, or help the patient get a home sleep study so they can be diagnosed by a board certified sleep physician that works for the home sleep testing company, and you could be the liaison or the messenger to deliver the message on how severe the condition is.
So really, you can kind of decide how involved or uninvolved you want to be when it comes to treating sleep in your practice. Because I know a lot of the doctors who are listening to this are thinking, man, Dr. Dar, I'm already so overwhelmed. I've got so many things going on. Like this is yet another thing to add, and it's important. But a lot of times we don't necessarily want to make that commitment to dive in and do something brand new. So it sounds like we really have options in terms of how much or little we want to get involved.
Yeah, I don't do impacted wisdom teeth and IV sedation. I don't do all on 4 or all on 6 cases, which means, a bunch of implants and dentures screwed down or snap onto. But I refer for them. I have an oral surgeon that works, down the street from me, and I refer the wisdom teeth. So if I see impacted wisdom teeth or a patient has discomfort, I'm not going to just let it go. I'm going to send the referral. And it's the same concept. If I could train myself to do wisdom teeth, impacted wisdom teeth and IV sedation, and that interests me, I would go and learn it. Just the same way, if you're interested in doing sleep, you can come to me and I'll teach you how to do it and how to implement the system. The only difference is making a mouthpiece is so much easier than most of the dentistry that we do. It's all about the system in place. Who to use for the home sleep testing company, who to use for the medical billing company, if you want to dive into that. And those are the real barriers. The rest of it's really easy. The value of the patient that you help to sleep better, sleep next to their bed partner, whether it's a new partner or the existing partner that doesn't sleep next to them or is annoyed by their sleeping or by their snoring, or someone that it's related to going camping or on the airplane or anywhere in more of a, let's call it, setting where some people share a room when it comes to conferences and work, right? It's embarrassing to put a CPAP machine on or nothing at all. And so, as a dentist, we can look in the mouth, look in the medical history, share our what we see to the patient, and just let them know, do you want me to help you? If they don't want it, then it's okay. At least you planted the seed. A lot of times, Tim, I have a patient come back 6 months later. They're like, you know what, Dr. Rad, you were telling me about this, sleep test thing or this appliance thing that we were talking about. My wife is, blood, and it's just like your conversation just starts up again. And I chuckle inside a little bit. I go, no kidding. I already could have, I could hear you snoring just by sitting upright. You kind of snorted a little bit when you were talking. I mean, it's really obvious to me nowadays after I've treated a few thousand patients. But some of the patients have no idea that there's an oral appliance. They have no idea that a dentist can actually look in the mouth and the medical history and be like, Tim, I'm a little concerned. You may not be breathing well. This can have ramification of 12 to 15 years off your life, 5 times higher risk of cancer, and a bunch of other medical conditions. Can I help you? And if you're too shy or, let's call it, embarrassed, why are you here? Why are you doing this? You're shy or embarrassed to replace a number 19 implant on the lower left for $4,000? Not really. If you do implants, why not do sleep? And so really we have to get out of our comfort zone, I guess, and at least talk about it with our patients and refer them for an evaluation with an MD if we don't do it ourselves.
Yeah. Wow. So powerful. And just the ability to have an impact on people and change their lives and change their trajectory. But, I'm kind of curious too, right? Out of the patients coming into your office, like approximately how many, right, is a percentage? Is this a large problem? Is it like 1 out of 100, 5 out of 100? Like, do you have any idea like how prevalent this problem is for the patients coming into a practice?
So the average patient, great question. The average practice sees 20 patients a day. And now it's estimated that 30% of patients have sleep apnea. So you're looking at roughly around 6 patients a day coming in and out, whether they're coming for their hygiene appointment, a crown appointment. Tim, if you remember, I had a slide up when you came to my courses, and it was a huge scalloped tongue. And then I talked about molar preps. And a dentist is sitting there trying to do a crown on the upper right molar number 14, upper left molar number 14, the upper right number 3, and the tongue's in the way. And you're hoping you don't nick the tongue, and you're working on an upper tooth, and you're wondering what's going on. And if you don't have a good assistant or an isolite system or something like that, there's a high likelihood you can nick the tongue when the tongue is a little too big for the mouth because the arches are more narrow. That's another indication. Right away, I bring the patient up, I say, crown looks great, everything that you did great. By the way, when I had you back, I've noticed that your airway looked a little obstructed. Do you feel like you get enough sleep? Are you tired throughout the day? And so the number of patients that are walking through the door doesn't necessarily have to be new patients or hygiene patients. It also can be during your treatment where you bring them back, you see a red flag, such as the tongue in the way, and then it just becomes a conversation of asking them how well they sleep. So about 30% in America. Now, if you go to a little bit more of the southern states, there's a little bit more of an obesity epidemic. But the obesity epidemic is not the only reason. I mean, I was 165 pounds at 6 feet tall when I had my car accident. So a quarter of the patients are not obese or have larger than 18-inch necks for men and 15-inch for women. It's the anatomy of the jaw being the soft palate and the size of the tongue and the width of the arches that determine for most people if that tongue falls back and hits the back of the throat and causes sleep apnea or snoring.
Wow. Well, right. I mean, that's such a huge number of patients that you're already seeing in your office that you can actually offer a solution for, right? I mean, you don't have to start a new marketing program. You don't have to do advertise, right? These are people who are already in your in your chair that you've got a relationship with and that you can really help and serve. So that to me is just a big missed opportunity if you're not taking advantage of this. And so give me just this is not a clinical show, but give me just a real high level overview of what some of the different options for treating sleep are.
So you brilliantly mentioned the patients are already in your database. You already have active patients, and some are not even active, that you can send an email to once every other week. Give them some valuable information. 12 to 15 years off your life. Did you know if you have sleep apnea, your life expectancy is decreased? Come in to Dr. Rad, and he'll do a complimentary consult to evaluate your sleep and your snoring. Send. 2 weeks later, sleep can affect your mental health. 46% of diagnosed depressed patients are as a result of sleep apnea. Come in for a complimentary consult, or bring it up at your next checkup appointment with Dr. Rad. Now, treatment. It's only CPAP. You asked about the treatment. Well, there's CPAP. There's different kinds of masks that they can try. It's not just a full mask covering their mouth and nose. Now, the nasal hood masks can be a little more comfortable. There's oral appliance therapy. And then there's a couple different kinds of surgical procedures. One is the triple UP, which is about 50%, up to 50% effective, where I call it roto-rooter your throat, where they take the uvula out, your tonsils out, and lift kind of the pharyngeal muscles back there to be able to get more room so the tongue doesn't hit the back of the throat as prominently as it usually does. And then there's the Inspire surgery, which is a hypoglossal nerve or the tongue stimulation, a little sensor that's put underneath your skin here. And when you put the little attachment, a sticky attachment on where the sensor is, it sends an electrical signal whenever you have the tongue relaxes to keep the tongue taut and contracted so it doesn't fall back. And that's called Inspire for more of the severe patients. So really, those are the treatment modalities. I actually created a sleep supplement during COVID when all my patients were like, "Hey doc, the mouthpiece is great. I don't snore, but I can't shut this mind of mine up because I'm worried about my kids, about my mom getting sick, about me getting COVID and dying and this and that." So I'm taking what? Tylenol PM, Advil PM, Xanax, marijuana, drinking half a bottle of wine, and all these types of medications and drugs and even over-the-counter stuff. And that's liver and kidney toxic. So I got in the driver's seat and did some research. I put my Rad biochemistry hat on. That was my major back in college. And I found that the ingredient N-acetylcysteine, or NAC, if you just Google NAC and sleep apnea, which is what I put in Rad Z's, my formulation that I created back then, you will discover that there's a 30% reduction in a clinical study from the National Institute of Health in your AHI, or your apnea-hypopnea index. A 30% reduction in sleep apnea just by using NAC itself. Now, when you use it with L-theanine and some of the other anti-anxiety type of supplements, which my product has, that helps the patient not only stay asleep and fall asleep, but breathe better as well. So those are really some of the, I call it, treatment modalities. Of course, losing weight can be one of them too, but it's an oxymoron or a catch-22, like trying to lose weight when you don't sleep well. And when you sleep well and get deep sleep, you produce leptin. Leptin is a hormone that helps increase your metabolism, helps curb hunger and crave bad foods. So it's hard to do that when you're not sleeping well.
Yeah. Well, and actually that was very much the position I was in when I first met you, and 15 years ago, is right. I was obese, overweight, and really my hunger sensation didn't get shut on and off properly. And through attending your lectures, right, I learned that, oh, hey, maybe I have sleep apnea. I'm married to a dentist. We actually implemented her system in her office, and I was her patient zero. And all of a sudden I got my device, and all of a sudden my hunger level started adjusting, and I wasn't as grumpy. I wasn't as irritable. And a lot of the depression and mental issues I had just started to go away. And right, all these things that I'd struggled so hard to fix and work through, whether it was medication or psychiatrists or psychologists, all of a sudden they just started resolving themselves by treating sleep. And my wife likes me a whole lot better now, thanks to you too.
I'm glad, as I joke around, but it's serious. Dentists can bring a lot of goodness to a relationship. We bring people back into the bedroom together. And you know, you're married, and you know, when people are divorced, imagine what happens when they start dating, right?
Yeah.
They get intimate for the first time, and they snore. I mean, imagine, there's no good way to explain how that feels. It's embarrassing. You know, you end up, you can't really bring a CPAP on your date and bring it to your partner's house if you're going over. It's a lot more easy to be able to take your little mouthpiece with you on a date. As I joke with some of my single patients, don't forget to take your oral appliance with you if you're going on a date and you feel like you're getting lucky. Let's be adults here. It does happen. And so it helps a lot with that kind of confidence, that social well-being, that I'm not going to, you know, snore too loud or at all when I'm sleeping next to someone.
Yeah, my wife jokes that it's the sexiest thing I wear to bed every single night.
Uh-huh. Yep.
And
Yeah,
it's so true.
yeah, and you get, again, with the oral appliance, you can wear it on an airplane. It's easier to take on cruises, when you go camping. So you know, when you go visit the in-laws, it's a lot easier to, you know, to keep clean. I think I told you I developed a little spray for it called Rad Fresh to clean sports guards and night guards and Invisalign. I don't know if you're a big football fan, but I got 8 NFL teams now using my Rad Fresh on the sidelines to get those disgusting sports guards that they, you know, use and our kids use and whatnot. And we really didn't have a great solution for cleaning our guards or our appliances. And so I just love introducing things to the dental community and to the general public, just to have a fun at it and get more healthier on dentition and oral cavity.
Yeah. So coming back to kind of the different modalities of treatment, right? With any kind of treatment, there's compliance issues with the patients, right? Patients have to actually implement and use whatever is prescribed. And so among the different modalities, what kind of compliance rates do you see among the different treatment options?
Yeah, so when it comes to the CPAP, the continuous positive airway pressure, the mask, roughly 50% are not compliant. And I've actually even seen studies that say up to 71% are not compliant. What's not compliant? They're not wearing it on a nightly basis, and they're not wearing it for at least 5 hours. So some of these studies, oh, if you wear it at least 4 hours a night, 4 nights a week, that's compliance. And that's ridiculous to me. That means that there's a few hours in the night that you're not wearing it, and not to mention a few days in the week. So the appliance has been estimated to or have over 80% compliance in some of the studies out there, relative to 30 to 50% in the CPAP world. And really, compliance has now put the oral appliance as the gold standard to be able to treat sleep by the American Medical Association. That was a big shock for me to hear at the American Sleep and Breathing Academy conference a few years ago. I have it when I was there getting my diplomat status. Everyone was like, CPAP's the best, oral appliance is second. Now we're talking about how oral appliance is definitely leading over CPAP, especially after the recall that Philips had with over, I think it was 1.5 million machines in the United States. They recalled, and these patients were kind of stuck. Like, what do we do now? And they kind of got PTSD from it, wondering, you know, that plastic is causing cancer. Well, how am I supposed to trust this now? And that's, a lot of them went to the oral appliance route. So compliance goes up with the oral appliance a lot more. It's a lot easier to use than a CPAP machine.
Wow. Now there's certainly a lot of benefits that we've been talking about with all these different treatments, especially the oral appliances. But are there any downsides for the practitioner? Anything that the dentist should be aware of if they're treating sleep in their practice?
The biggest pushback that I get is how to implement the system. That's number one. What's the system? Screen the patient. How to do that? Well, it's how you just bring it up to the patient, which we've gone over, or give them a new patient form called a sleep questionnaire for all the new patients, because they don't know any different. And that's where the conversation starts. And then who to refer to for a home sleep test, which appliance to use, which lab to use, all that, right? That's all the stuff that I teach. Then it's, what about the bite changes? What about the fact that it can make your jaw come more forward over the years? What about TMJ? Well, what about the person dying? What about the guy who fell asleep at the wheel? If I crashed my car into a human being, I wouldn't be sitting in front of you right now. I don't even know how my life would have turned out. Involuntary manslaughter? I mean, thousands of accidents occur every year because people fall asleep at the wheel. If some dentist was looking in my mouth and knew what to do in regarding screening for sleep, I may have not had my accident. Of course, my accident propelled me to speak to you today. So I'm always thinking of as a positive lesson that we learn from all the unfortunate things that happen in our lives, right? But really, it's at the end of the day, it's the pushback is the bite change. If you wear a morning aligner and I give that to a patient, that reduces the chances of bite changes or a job coming more forward. So in the morning, I make a morning aligner for patients who are in the morning to wear for 2 or 3 minutes, and that will reduce any sort of dental implications, which is given in an informed consent anyway. So yes, there's a sleep study diagnosed by a board-certified sleep physician saying that this patient has a disease that's deadly, not to mention socially it could affect someone. And so now as dentists, we're worried about a 1 to 2 or 3 millimeter shifting of certain things like a jaw or a bite. I mean, with all due respect, we got to get over ourselves as a dentist and not think about millimeters and think about the total health of the patient and the fact that we are only the human beings that can provide this kind of treatment. It's not a medical doctor. All they do is throw a cpap at the patient. And when you have 50 to 70% non-compliance, you're left. Not everyone's going to go through major surgery. So this is really an important. Let's get some confidence in what we do. Let's remove all these fear-based thoughts. Living in fear is so toxic. Living in gratitude and being grateful in what we can offer for patients, and them in return being grateful for what we've given them with respect to their sleep, it's just priceless.
Yeah, it's huge. And in fact, I just looked up, highway traffic incidents due to drowsy driving. 91,000 crashes a year, Dr. Dar, 91,000, 50,000 injuries, and nearly 800 deaths are caused every single year because of drowsy driving. And right, one death is so much more impactful than a couple millimeters in the mouth. And so I love you really, pushing that point home.
Yeah, it's sad that we have to sometimes, get hit rock bottom to figure certain things out. And let's actually be enlightened and give and have compassion. Lead with that as opposed to a concern that you're doing something. You still, dot your I's and cross your T's, so to speak, to be able to perhaps protection in case something in their jaw and teeth goes disarray by giving them the informed consent. But again, at the end of the day, I believe that a dentist that doesn't treat sleep should be held liable when they have the information to know in the mouth and they're kind of being shy because they just charged the patient $12,000 for 3 implants. And now we're being sensitive towards bringing up the fact that we see some indications of sleep apnea because we're embarrassed or shy. We don't want to lose the patient. We want to make payroll. We want to blah, blah, blah. And these are just excuses. Again, you don't like to do it because you're afraid you're charging the patient too much or they're going to think you're trying to pay for your next vacation. Refer it. So simple. Refer it to an MD. At least get them to be aware of the problem because you see something they don't see and they don't know that could exist.
Yeah, no, so true. I kind of want to talk about systems a little bit, and then I want to talk about the monetary aspect. This is called the Dental Wealth Nation show, so we want to dive into that too. But I always like to make sure like what we're doing actually makes an impact. And so systems, they are so important. If you don't have good systems, things fall apart. You can end up with more chaos in your office, and you can really regret, starting down a road and adding a new treatment plan and a new modality of serving your patients. And so talk to me a little bit about the systems that someone should have in place and really what you've done to help simplify this process for doctors who want to treat sleep.
So first of all, you have to have your staff trained. So I created these little short videos for the hygienist to be able to know what to look for in the mouth and the medical history and to be able to hand off to the doctor, including for dental assistance if the doctor does the hygiene. Then you need a video or some sort of presentation for your staff to be able to know, oh, I need to ask for the medical insurance card. How do I send a home sleep study over to the home sleep testing company? How do I send the information for the medical billing company to do? Because I don't recommend medical billing being done within the dental office, at least not for a while, because that's just more hindrance and more work, which pushes the staff away from wanting to help you and promote and do this. So that's initial is training. Everybody needs to get trained. The doctor needs to get trained with the full day video. It's about a almost 6 hour video that I have for the training, and then the hygienist and the staff. And then now when everyone's trained, we need to have, just the same way every single athlete that's very, very famous and top of the world, like Michael Jordan and the late Kobe Bryant, or to Ronaldo or Messi, there's a coach on the sideline that helps them during practice, tells them what to do, what plays to run, what the defense looks like. And this is what I do differently is you don't just look at the videos and go on Monday and do it. I coach you every week. We have a 30-minute call for 6 months. We talk together, we figure out any sort of troubleshooting, and I keep you on track to be able to screen your patients by another system in place. New patient form, a screen questionnaire for sleep that asks simple questions such as, have you ever fallen asleep at the wheel? Do you snore? Do you feel tired throughout the day? Do you have high blood pressure? So a bunch of questions to be able to open the conversation of how well do you sleep at night, and I can help you. So that's really the basis of how to be able to incorporate it into an office. Then you got to know how to take the impression or scan. I do have these bite jigs that you can put in the mouth to take the bite. My assistants do it. Any assistant can take the impression. And then which appliances to use. I love the Sleep Herbst appliance. I've been wearing mine for 14 years. I have 9 different appliances. I've tried them all. And there's an appliance for everybody, yeah, but Sleep Herbst can work for almost majority of sleep patients, even patients who have TMJ. So I go over which appliances, which lab to use, how to write up your chart notes, because they should be in SOAP format, not just 4 bite wings, 2 PAs, exam, prophy, sleep appliance. You got to do it the right way. So there's templates involved, forms involved for the CPAP affidavit, because even the mildest patient needs to sign a form that says, I don't want CPAP or surgery, so that there's an informed consent given to the patient that there's alternative benefits or alternative options for sleep. So that's the system. This is all, the things that you got to do. Now, by the way, if you came and we did an implant for you, I would tell you the risks of doing an implant, the fact that it could fail. You have informed consent. There'll be a financial arrangement form. I'd probably show you a video or some sort of flip chart on what the implant portion looks like, what the abutment and crown looks like. It's all the same. The only thing is the dentistry is so much harder placing implants and hoping that doesn't fail. And it's $4,000 compared to the sleep, which is a joke to be able to make a mouthpiece and fit it right. I mean, and that's really the system, so to speak, in a nutshell on how to be able to do this in a dental practice.
Okay. And start to finish, how many patient visits are we looking at on average?
So on average, you're looking at 3 to 4. One is to screen the patient. A lot of patients nowadays have a sleep study that we had no idea until you get brave enough to say, hey, Tim, I see that you may not be breathing well. How well do you see? Oh, yeah, I got a sleep study a year ago. They gave me the mask. I gave it back. Cool. Can I get the sleep study? And right then and there, the next appointment is typically either go review it in the sleep study because you sent it out, or we take impressions or do the scan, or we go direct to that right away and charge the patient. My cash fee is $2,950. I've seen cash fees range from $2,500 to $7,000, $8,000. I keep it very fair. I do about 30 to 50 appliances a month. So I make a great living at $2,950. It seems like to be the affordable price in my area. And so first appointment, screen. Second appointment, usually take impression after you review the sleep study. Third appointment, deliver. Fourth appointment, to check and adjust. Now, some people that are severe need more adjustments, and I incrementally move the appliance forward a millimeter at a time to make sure their jaw tolerates it. So it could take anywhere from 4 to 6 appointments at most.
Wow. So right. And that's one of the things I loved about your lectures when I was attending them is you really have created a system and a process that any practice can implement and just hit the ground running.
Yeah. And, it's a system that I guarantee it works. The doctors that provide a compensation and an investment on their behalf. If it makes you money, it didn't cost you a thing, is
Yep.
what my friend Dr. Anissa Holmes says. And it's true. It's so if I don't provide the value, and we're going to dive into the money part in just a second, if you don't make your money back, I'll give you your money back. It's ridiculous that I even bring that up. But it's going to, on average, a practice the first year makes $250,000, 240,000 is what the average we've seen after they implement the system and the coaching that I put in place the first year. And that's on average. I've had some offices do a lot more. And so, it's a quote unquote guarantee that it works, because it's just, you got to just do the work and the rest will come. You already have patients in your practice. If you're seeing 1 or 2 hygiene days a week, you already have at least 3 to 5 appliances right away that you can do. That's at least 9 to 15 grand the first month. That's just when you get started.
Yeah.
And I'm not even talking about how we're going to help you grow your practice by having medical doctors refer you sleep patients, because you're going to get into a good networking capability that all it costs you is a stamp and some time.
Well, right. And that doesn't even, touch on the opportunity for some of the DSO owners out there to really implement that and grow what's most important to them, which is the EBITDA of the practice, right? This has huge opportunities to really differentiate a DSO practice also.
Yeah, I mean, $250,000 added to a practice at 5X is 1.25 million in your pocket. So it's not really 250, right? So if you're thinking about exiting, or if you're thinking about, as a DSO, you want to make your numbers go up, you need to add sleep apnea to your practice. I mean, you also need to add Botox to your practice for TMJ purposes. It's such a big moneymaker nowadays. Everybody is clenching and grinding their teeth. Everybody. I literally, this week, I think I did 12 patients for Botox. I usually do maybe 5 to 10 in a month. It's just a clenching intensity. It's not just an occlusal splint and bite and all that and airway. There could be a need for Botox in the masseter temporalis area. It relieves majority of patients, gives them 3 to 4 months of relief as an adjunct to the night guard and whatnot. But really, for a DSO, I mean, you have 5 offices, 15 offices. To incorporate is so easy. You just have to have the interest to do so and make your DSO or your office stand apart and shine compared to the other ones out there. Whereas a private practice who wants to go into a DSO, imagine if you offered total health, total wellness approach, kind of a holistic way of treating patients really with an oral appliance, because it's not medicine or medication, excuse me. It's called gentle in the way we're treating a systemic disease and all the dental ramifications of what acid reflux does to the teeth and what grinding does to the teeth and all the stuff that our dentistry can fail because the patient has sleep apnea. I mean, it's huge for DSOs to do it. And if you want to talk numbers, at a 5X we talked about, but there are DSOs out there that are ready to go 8 to 10X. And if you put in 2 of the practices and see how it goes. And I've done that for DSOs. I've incorporated in 2 out of the 10 practices or 1 out of 5. And then they're like, okay, when are we going to do this next in the other one? I go, hey, I only take so many people on every month. I'm also, still practicing a couple days a week. So, I can only help so many people, but the more I'm getting busy, the more I'm going to have to step away from practicing, because if I can help one DSO who has 20 offices or whatnot, that's helping thousands and thousands of patients sleep better and hopefully not get into car accidents and 5 times higher risk of cancer and heart attack risk and all that.
Yeah, I mean, it's significant impact. And the money piece is there, right? If you've got 5 locations and first year you do 200,000 in sleep in each office, it's $1 million at a 5X multiple. That's a $5 million increase that you've just done by treating sleep. Not to mention, like you just said, the improvement in lives and the lives that are saved and marriages that get better. So the impact is so real with this stuff, Dr. Dar.
Yeah, it just puts them on a different platform of dental practices as an more elite practice, because not everybody's doing it yet. My job is to make everyone do it, right? Yeah. But you mentioned the 5X and whatnot, and let's keep it simple at 200 grand. Each appliance, the sleep herps appliance through the lab that I use that gives a special price for all my coaching clients, is around $390 for a sleep herps appliance. So $390, $29.50 cash fee. And a lot of medical insurances are paying up to $9,500 now if the deductible has been met and there's 100% coverage. On average, a UPS driver insurance is $7,600. The veterans with TRICARE, $7,600 reimbursement that the medical billing company bills and gets you paid for it. But let's call it the minimum cash fee of $29.50 and $400 for the appliance. You've got a big ROI. When you do Invisalign at $5,000 or $6,000 a case, and it costs you $1,500 to $2,200 depending on how many trays you're ordering, or Sure Smile is still $1,300, $1,400. I mean, the ROI is so much more on a sleep appliance compared to some other product that you're adding to your practice. Not to mention, it only takes 5 to 10 minutes per appointment. And so it's a lot, and 4 appointments on average. So the efficiency of making money is really, really high. The ROI is high. And my very good friend, Elijah Desmond, who runs so many different great platforms, including Backstage, which is a mastermind group with a bunch of professionals in dentistry and beyond, really said a return on life, an ROL. I mean, that is just the priceless stuff. When I get a wife coming in and on the third appointment after we've delivered, or on the fourth appointment, and they're like, "Doc, I just want to thank you." I'm like, "Oh, hi, nice to meet you, Janice. You must be the wife, hopefully." And yeah, I just want to thank you. Like we're sleeping next to each other, or it's not keeping me up at night. And that to me is priceless. It's the $29.50s in my pocket. I did it in my sleep, pun intended. And it was such a grateful thing, or such a happy occasion to see someone be grateful for it.
Yeah, no, so true, and such a big impact. And right, we've been talking about sleep, but I want to bring this back to really exploring personal growth, because I know you're also very focused on that through sleep, through health, through the Rad supplements that you're doing, just through everything, right? You're really focused on that personal growth piece. And so, for those of us just kind of tuning in and just listening now, right, tie together a little bit of how you have grown personally, from starting off by falling asleep at the wheel and where you are now, and how that's really helped fuel your personal growth.
Tim, I really appreciate that. I don't usually like talking about myself. I like talking about other people and helping other people. But really what I've experienced in life through my escape from my country when I was 6 years old, to go on horseback and at 6 years old and be forced to leave my country due to religious persecution. And to see that even today, where there's religious persecution out in the real world in America, let alone in other countries, it builds something. And it builds something that's not in victim and fear and anxiousness or sadness or grief. Sure, there's some sadness in me or some fear, but it's very minimal now. I take every experience that I've had, including my car crash, including the divorce I've been through, as a lesson that has propelled me to become a better man. I've been through retreats with Dr. Joe Dispenza and Danny Morell. I'm going to Tony Robbins in November in New York. I've read countless books and podcasts. I meditate. I've learned so much through a relationship coach that I've had, through a business coach that I've had. Working on yourself isn't just going to therapy and coming back and saying, "Yeah, I'm good." It's about leading with compassion, leading with kindness and empathy towards your fellow being. When a patient is upset in my chair for some reason, I don't let my ego take over like it used to. And to be able to do that, let's go back to it. You can't do that if you're not sleeping well. Try being in a grateful state when you're tired. It's very challenging to be in a positive, loving, compassionate, empathetic mindset, mental health. And a lot of men today, I've had 4 men, all of them in the dental field, earlier this year, reach out to me on social media telling me, "Dar, Dr. Rad, how do you do it? How are you doing so many things and you seem so happy and you're still traveling?" I'm thinking of taking my own life. And boom, I mean, it hit me how much we are all just really, really, some of us are struggling with our partners, with our kids, with ourselves. A lot of men have a lack of self-worth. They feel they haven't done enough compared to their dads, compared to what they thought they would do, whether it's financial or in a relationship. And that ties into a special passion of mine is now Dr. Farouk Jabay from West Palm Beach, Florida. Him and I have kind of had similar backgrounds and experiences and worked on ourselves. And we formed the Menery Group. The Menery Group is a group for dentists and other healthcare professionals that are in the health space for men that need a little bit more push and guidance to be able to become the best versions of themselves by taking actions, not just listening to some motivational talk, kind of like what I'm telling you right now, and really focusing on how to control their ego and their anger. I mean, man, just doing that, listening to a criticism and going, I'm going to just observe. I got criticized. I'm paying attention to it. It's triggering me to respond, but I'm not going to respond. I'm just going to allow the person's feelings to enter and not have an attachment to it, and let the person know that I care about. That is not my intention to make you feel that way. Boom. It just lowers and de-escalates any conflict, whether it's with your partner in life or a patient or a coworker or an employee. And these are some of the things that, when I look at the movie biography of my life, and when you look at your biography of your life, and I know some of you have had some real hardships. When you go talk to your child self and coach them through it, knowing what is about to happen for the next few decades of your life, at the end of the day, we have to lead with compassion and empathy, and that's the only way that we want to be treated. But we have to do that first to mirror, so that we have the world mirror and give us the same in return.
Yeah. Oh, such profound insights, Dar. And thank you for sharing that. It's a message that's so needed today, because we can certainly find inspiration, but you got to get out there and you got to take action if you want to have that impact. If you want to change, you actually have to put into practice the things that you're learning. And so thank you for just not investing in your community, but also in men in general and helping us improve our lives. So thank you for that.
Absolutely. Yeah. The menergygroup.com has some more information in that. I call it Menergy because, men have good energy too. And it's all about not leading with our toxic energy, being leading with as much compassion. You could still provide, you could still protect and be in that masculine state for a man, but you could do it in a healthy format when you control your emotions and your anger and your ego. It just helps with everybody. And it just makes you happy. Don't you want to be happy? Everybody wants to be, live in a free kind of mentality. And that's why making 250,000+ a year doing sleep gives you a little bit more freedom and less, work on your neck and your back. And maybe you can get the younger associates to be able to do that while we dive into doing some things a little bit easier, such as treating sleep apnea.
Yeah, no, I love that. So how can we get in touch with you? How can we find out more about either taking your classes or being involved or the Menery Group? What's the best way to get in contact with you and stay in touch with all the things you've got going on?
Yeah, so you can email me at my name is Dar Radfar at gmail.com. That's my email. My name at Gmail, Dar Radfar at gmail.com. And send me an email. I always respond to them try to respond to them within 24 hours. The menergygroup.com is the website for the information for the men's group. We have a retreat and summit that's every year. And then also my products and my brand at radhealthinc.com. That has all my products in there. I'd love you guys to take a look. And again, anyone who wants to be trained in how to do sleep, how to incorporate it with the system, my seminars are available. Again, it's virtual seminars, and then we do coaching one-on-one for 6 months. I'm on top of you all to be able to make sure it's successful and it's guaranteed to succeed. And that's at radseminar.com. You can send me a message through that website if you're interested in me talking to you about incorporating sleep apnea to not only make you even more wealthy, but also mentally and heart-centered more wealthy.
Excellent. And the links are down below if you want to check those out. And so, Dar, before we sign off here, any closing thoughts for us?
Yeah, I love working with dentists. When you guys see me and gals see me at conferences, please come and say hello. Share me your experience. I want to know what other people's journeys have been in the process of being a dentist and where they are now. And I want to really focus on the fact that when we are with each other in conferences and we are speaking to each other, let's lean on each other to help each other grow, not only with our finances and our practices, but also anything that you've learned that could benefit other people within your personal life. I've had some people come up to me and tell me that plant medicine has been working for them, and they do certain sort of ketamine therapy and all these things that I never even knew about. Now that I know and existed, it may be an option for myself or some of the men or women out there that come up to me and tell me, hey, you're an inspiration and you lead with such a positive light, but I can't get over X, Y, and Z, and I've been doing this. So let's share the knowledge and information. So reach out to me if you have any suggestions on retreats and other things that you've experienced. Can't wait for Tony Robbins end of this year. He's only going to be around for so long. So, let's grow together. Let's learn from each other. And if I can help anyone in any way, please reach out.
Excellent. Well, hey, thank you, Dar, for being such an amazing guest. Thank you for sharing so generously with us. And thank you for the impact that you're having.
Thank you, Tim, for having me on. Thanks for all the good work that you're doing. Our friendship is even more solidified after today, after 15 years of knowing you. You're doing a great job. Thank you.
Excellent. Well, we'll see you again here soon on the Dental Wealth Nation show.
You've been listening to